This is Healthcare Uprising. We are here to shine a light on the innovators implementing positive change in American healthcare and the patient experience stories, good and bad, that can help others navigate the sometimes overwhelmingly complex American healthcare system. Welcome to the Uprising. We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional.
So Art Pharmacy is a social prescribing company. Social prescribing is a practice that emerged in the UK formally in the 1990s, a practice through which healthcare providers prescribe non-clinical community-based supports to patients across a range of different types of interventions. There's nature prescribing, art prescribing, volunteer prescribing. We can prescribe, people prescribe housing, people prescribe food, right? You kind of think about health-related social needs, certainly falls into the social prescribing universe. And our focus is really narrow in this arts-based social prescribing space.
So you say you prescribe this stuff. Is this covered by insurances and whatnot? Like, is this like other prescriptions where it's somehow paid for? Like you pay for the art supplies, or you pay for whatever it is you're prescribing like that?
That's right. It is. Sometimes, we do contract with health plans. It's a uphill battle for sure, but making great progress.
That's cool that they're even willing to do that, honestly. That surprises me. I'm blown away by the fact that insurance companies will pay for paint. I I mean it's a great idea, but I just didn't think they would pay for anything but pharmaceuticals and surgeries.
Yeah. Well, and I think a lot of that is strictly out of need, right? And I think I hear this kind of across the startup space, especially in mental health, is go into insurance plans and them really being in a spot where they are saying, we have a very high demand and we are not sure how to address it. And how do we do that differently? And I think that is what we hear consistently from folks across all platforms. And I think it's just thinking of alternative ways that are perhaps more stigma-free or more accessible or seem closer to hit closer to home for individuals makes sense. And I think, whoever we talk to in terms of partnerships, there's always somebody in the audience who's like, well, yeah, I go to my local dance studio or I go to an art class and that made me feel XYZ. And it's something that brings me closer to community. I think it's something that's easy to relate to. And a lot of folks have had experience with personally too, which is great.
Yeah, I was going to ask exactly like what is the experience for somebody who gets a prescription to arts and culture? Like, is there an app? Like, how do they choose? You've touched on that a little bit. If you can maybe talk a little bit more about that and what it feels like.
Yeah, I'm happy to take this. Me and Chris are just smiling at each other. We're both chomping at the bit to share. So yeah, in terms of a prescription, so that referring partner that we talked about submits the referral to us in our care navigation teams. These are individuals who are experts in both supporting individuals, but also really clued into the arts and culture scene and better understanding the arts and health perspective. They review that intake. They better understand the individual. The intake includes arts and culture preferences. It includes well-being goals. It includes any information that would be helpful. And then those care navigators are going in and making suggestions for the individual in our system. So we're utilizing some matching technology. We're able to really look as to both the well-being preferences, the arts and culture preferences, their location, their age. We're factoring all of that in, making some really, really personalized suggestions, as Chris mentioned, to ensure that these are things that are going to be of interest to the member.
Typically, just as you've said, you go see your PCP and you get screened for depression and there's a positive screen, the PCP has a couple of options. They can write a prescription for an antidepressant, which they do. The patient would probably not adhere to it. Adherence to SSRIs is in the low 40%. That PCP probably doesn't ever get any feedback about whether or not the patient was compliant with the program that they'd been put on. So that's one option for the PCP. And then the second is to say, I'm going to refer you to see a therapist. And I got bad news for you. You're probably going to have to wait 60, 90, 120, 180 days before you see someone. Doctors don't want to do that. Doctors want more tools in their tool belt than that. And so we're putting another tool in the tool belt for our prescribing partners. The stories that get me excited are the stories when I hear about patients or members that started engaging in these activities with Art Pharmacy, but then were introduced to these arts and culture organizations, were introduced to new practices, got connected with other people that they met out at these venues and community organizations, and then start doing it independent of Art Pharmacy, right? Like that's the dream, is that people are able to access these resources that already exist in their community independent of our work. And that we're opening doors and serving as a enabler or launching pad for people. There's
catalyst to culture.
Yeah,
that's
and exactly
sustainable.
Right.
Yeah, and sustainable, right? Like a lot of mental health support isn't sustainable, right? Like you are seeing me for X amount of months and then you don't see me, and that is a huge drop off for a ton of people. That offboarding of individual therapy, even if we're doing it in a way that's like very mindful of down to every other week, then down to a month, that is a really tough transition for a lot of people. And so exactly to Chris's point, this is an amazing opportunity for us to find sustainable solutions to, supporting loneliness or supporting, opportunities to get in the community.
This has been a Shut Up production.
Shut up!